Now, in West Africa, the Ebola virus has been deadly, killing at least 110 people. The World Health Organization says the current outbreak is among the most challenging ever. The disease has spread from the forest of southern Guinea to its capital, Conakry. VOA's Pearson spoke to one of the top U.S. experts on infectious diseases about how to contain Ebola and stop the outbreaks.
These doctors are suiting up to care for patients who have Ebola, one of the world's deadliest viruses. The humanitarian organization Doctors Without Borders is helping local healthcare workers in Guinea treat Ebola patients. The fatality rate for this particular strain that is broken out there is up to 90%. People in the region are panicked. This man says most people have never heard of the Ebola virus before and are now very afraid. The virus has spread to the capital, Conakry, from forests in the south. The World Health Organization is concerned that Ebola has broken out in a region where it had never appeared before. But Dr. Anthony Fauci, the director of the Infectious Diseases Division at the National Institutes of Health, says Ebola's appearance in West Africa should not come as a surprise.
It's a disease that's spread by direct contact with an infected person, but it's also spread by exposure to an infected animal like a bat. And since we know those animals are in those areas of those adjacent countries, it's not that unusual to see outbreaks in areas in southern Africa that are adjacent to each other.
Fruit bats are the primary carriers of Ebola, although the virus doesn't kill the bats. Humans get the virus from infected bats or other animals that these bats come in contact with. Dr. Fauci says people need to avoid eating bushmeat and bats when there's an outbreak of Ebola. The symptoms are very much like those of the flu: fever, weakness, muscle pain, headache, and sore throat. But that's where the comparison ends. The next stage in Ebola is vomiting, diarrhea, and in some cases, internal and external bleeding. The flu is airborne. Ebola is not.
Ebola is almost invariably spread by direct contact with bodily fluids, particularly blood and secretions, vomit, things like that, of people who are deathly ill and people are taking care of them. So it's usually family members, physicians and healthcare providers, ministers who minister to the sick and to the dead, and to morticians who take care of the bodies.
The best way to control the virus is to get people with symptoms into isolation wards. Researchers are trying to find effective medications, but at the moment, the best chances of beating the disease are to drink plenty of fluids and get treated for secondary infections such as diarrhea. A number of patients in Guinea have recovered and have been discharged from treatment centers, but that doesn't mean they are completely free of Ebola. The WHO reports that men who have recovered from the disease can still transmit the virus to sex partners for up to 7 weeks after they recover. Pearson, VOA News.